please join me in welcoming our onstage Miss Margaret Lee, Chief Nurse, Alexandra Hospital, National University Health System, Associate Professor, Alice Lee Center for Nursing Studies, Yong Lu Lin School of Medicine, National University of Singapore. Miss Lee will share on how the role of nurses can be elevated to provide value-based healthcare, and how value-based healthcare can be put into practice from the nurse's perspective. Miss Lee, please.
Thank you, Shane, for the introduction. As you all can see, right, the rostrum and me, not very relevant. So please be content with me standing here as I take everyone through the next two sessions if you're staying for the second one as well. So first and foremost, again, I just want to say that I'm very humbled to be invited to share my perspectives with you. I'm no guru in value-based healthcare, but what I can say is that I'm very, very privileged to be a nurse. And because of that, I think there is some perspectives that I can share. And as we go through this breakout session, my invitation to everyone is, regardless of what roles you assume in healthcare, hopefully there's something that you can take from what I can share today to see what it means to you, because each and every one of us have a part to play in building the kind of healthcare system we hope to see. So this is how I will be taking everyone through this segment, and that is first and foremost to really bring us to have a good understanding of what is the context of nursing practice today. And then, in alignment to the topic that we'll be covering today, what are the kind of thoughts and perspectives we can consider when we want to elevate nursing practice, and what are the other aspects of system-wide support that is required for nurses to really do their best in what they can do. So first and foremost, lest we forget, right? So I think this picture or pictures here can resonate with all of you. Perhaps my invitation here is, where were you during the past 2 years of COVID? What were you doing? How were you feeling? How were you affected? And now that we have the privilege of coming out of it, even though we are still encountering COVID and the effects, what have we learned? I think these are moments that happens in our lifetime that sometimes we don't understand why. Some of us who have been in the system long enough would have gone through SARS as well. But we also know that what we encountered during COVID-19 was unlike what we encountered during SARS. So in essence, in every adversity, it brings about new opportunities as well. And the pictures that you see in the slides there are just what I can offer of Alex nurses where I actually practice in. I see the nurses in the dormitories swabbing the foreign workers who are so important in building our nation. I see the nurses in different settings, pivoting as and when the needs arise. So we also know that, there have been many moments when nurses pivoted according to the needs of the population and the demands of the system. So these are really snippets which I hope, each and every one of you can recall that you have an important part to play in a healthcare system in your role as a nurse. And as we move out of COVID, and I'm sure for those of you who are holding leadership roles in positions of influence, where you make decisions on hiring, on retention, you would have many sleepless nights like me, okay? For example, you would have nurses who are tired, who are not able to take leave, who are not able to visit their home country. We worry about nurses leaving service, especially those who have journeyed with us for the longest time. I, for one, is someone who has been trained by a lot of my peers who are foreign nurses to get to where I am when I was an ICU nurse. And these people are family to me. So I think when we talk about work in our profession, it is really a mix of not just what our calling requires us to do, but the relationships that we build within. So when we see news like that, for example, the worry about whether we have enough workforce to sustain the future, I think it draws the importance to why it is so crucial that nurses take a different view of what it means to us when we spend our time in patient care, exactly what kind of task components are we engaging nurses in, and whether are they truly adding value to patient care. Then ministry and the entire government also tries their very best to recognize the work that we do. But we all know for a fact, hand on heart, that there's only this much money can get us, right? Yeah, it requires a lot of heart and soul in the work that we do to stay, especially in the difficulties that are beyond our control. So I'm not saying that this is not important. This clearly is a very clear recognition and signal how important nurses are. But I think what I hope to do today is really to draw everyone's attention to really unpacking what it means to us to be nurses and why is it that it is important that we play a more active role in advancing value-driven care. So why do nurses care? So I'm sure for those of you in the audience who are nurses, you would join nursing for different reasons. I, for one, didn't choose nursing, and that's because I did really badly for my O-levels. I couldn't qualify for any other course. But I'm very, very privileged to enter nursing and choose to stay in nursing. So I guess each and every one has a different reason why we choose to care. And then you think about all of the encounters that you have, the nurses that you're responsible for in your teams. I'm sure all of them would have their ups and downs, but why is it that they still choose to continue in service? I think for each and every one of us who continue to be nurses, we have to really hold that view that, it is precious and that we should hold on tight to each other, because only collectively as the entire body of nursing can we really make impactful changes if we are all in the same journey, in the same direction. So not so long ago, in fact on 12th May this year, and that so happens to be Florence Nightingale's birthday, McKinsey actually shared this report. So this report shares, and it came right out after the heat of COVID, about why nurses all over the world choose to stay. And I think what is frankly not surprising is really meaningful work. So there's a whole myriad of reasons why nurses choose to stay. There's also a whole myriad of reasons why nurses choose to go. Some are really hygiene factors, some are really because of the long haul of the pandemic, but more often than not, what the study found is really that a lot of nurses choose to stay because of purposeful work and meaningful work. And I think this is really a testimony of why you can't just be a nurse, or that you cannot pick anyone from the streets to be a nurse. So this is really how special it is, because it is through the work that we do and the process of caring that we grow leaps and bounds from the stories of our patients and the lives that we encounter. So with that as a backdrop, right, if you think about it, it is bittersweet, right? So it is really not, in fact, most days it's not a bed of roses, but we choose to stay because we all have different intrinsic motivators to keep us going. And the only way to continue going, and for some of us, it may be the one and only job, if you call it a job, that we have our entire lifetime. There must be a good reason why. So this is where it also brings about opportunities for us to think about what this means to us when we talk about elevating within nursing so that we can advance the profession and advance healthcare. So for those of you who may not be very familiar, this work is not new. In fact, the whole thought of wanting to advance nursing, wanting to optimize nursing roles started way decades ago. And back in 2015, then Ministry of Health and then the Chief Nursing Officer and the team of chief nurses came out with a set of recommendations, and all of this is intended to rise nurses up, and it is called the National Nursing Task Force Recommendations. So these are all information that you can easily find online. Essentially, it talks about how there is a need to emphasize on career development, and that gave the inception of growing the assistant nurse clinician role. And then we also have thoughts about how we should recommend more autonomous nursing practice, how we can also grow in nursing education as well as recognizing nursing. So this is something that came out in terms of recommendation 8 years ago, but it didn't just stop there. Soon after, 2 years later, in line with the 3 Beyonds that Ministry of Health has cascaded, we also see that there is a growing need for us to really broaden our perspective of nursing practice, to really push boundaries of care more towards the community for a very simple reason. The better we can keep the community and our population healthier, the lesser likelihood they will need to consume healthcare. So it is really a very simple equation, but so hard to achieve, all right? Because of many, many other compounding factors. But I would have to say we are still in a very good place. So with all of these recommendations, what is important is how we contextualize it. Because I'm cognizant of the fact that even as nurses, right, we may have different chosen expertise or domains of practice. Some of us in leadership roles have chosen different tracks. So we ask ourselves, what meaning does all of these recommendations mix to us? It is about how we contextualize it and how we make it meaningful for us. Because at the end of the day, whatever good recommendation that comes out, it has to be meaningful in terms of implementation. Only then can we see the outcomes that we hope to see. So with that in mind, and this is something which I kind of devised when a group of us went to lead AH, which I will share in the second segment of the sharing. And that is, I think for the longest time, having practiced for more than 20 years, it is not uncommon to hear nurses say, "I'm just a nurse." May I encourage all of you who are nurses today that you are not just a nurse, okay? Because for as long as our mindset tells us we are just a nurse, it automatically limits the kind of influence we have. But the fact is, like I've mentioned earlier on, it takes minimally 3 years to train a registered nurse. These things don't happen overnight. So it is really a matter of what do we take with us when we have that level of body of knowledge and expertise. So because of that, we are not just a nurse. So the next time you hear any of your peers or you catch yourself saying that you are just a nurse, remind yourself you are not just a nurse, okay? Because each and every one of us, we have an ideal, we have an aspiration, we have hopes and dreams. Why we either choose nursing or choose to stay in nursing. And we would belong to a team, okay? So it depends on which sector you're operating or practicing in. Some of us work in large systems, some of us in smaller institutions, it doesn't matter. Like it or not, we would have to align our goals and ideals to what the institution hopes to deliver. And this inadvertently is aligned to meeting the needs of the nation, right? So in Singapore, we identify ourselves across the different sectors as nurses and how we can contribute and play a part in helping to keep the community healthy, the population healthy. And these are very important perspectives to embrace because very often when we are tight on resources, when we feel that there are boundaries because of systems and institutions, it limits us from doing our best as nurses. So these are all important perspectives which will broaden our perspective about how else we can influence and really drive nursing to a higher level. And not to forget, from a very global perspective, we are citizens of the world. Like it or not, if there's no globe, there's no us, right? So for that simple reason, sometimes it may appear far-fetched that how are we going to identify ourselves with our counterparts across other countries? That is where conferences like this matter. Conferences and perspective and even skills attachment in other countries allows us to learn from different counterparts so that we can take what is good and what is meaningful and the whole learning is also reciprocated when we also host visitors. So this is really another avenue and a wide window of opportunity for us to grow in nursing practice. And last but not least, if we recall the founder of modern nursing, Florence Nightingale, and how she started nursing during the Crimea War, it was really back to the fundamentals. Good hygiene practices, sanitation, caring for the soldiers of war. Those principles still hold true today and most recently encountered during COVID, right, where we were so obsessed with hand hygiene, with basic hygiene practices. So in the end, right, we will move through times, we will encounter different challenges as nurses as we live our lives. So what holds true is always about, the whole essence of nursing through time and how it should be contextualized to be meaningful for the context of the given landscape. So in order for us nurses to really think about how we can enable value-based care, it will require us to think about how we want to shift our paradigms to be able to add value to the kind of care that we will be developing for our patients. So over here, I would be recommending a few shifts that I thought would be very meaningful. So first and foremost, I'm sure all of you are very familiar with Patricia Banner's model of novice to expert in terms of professional growth. So this is something that very typically every single new nurse would have to go through. You start first at the very basic. You learn as much as you can in school. When you go into practice, you consolidate your practice. Over time, you build your domain skills and knowledge to be more proficient in your practice. And that is where you get a higher level of autonomy and influence. In our practice today, it requires us to rethink this, not to unlearn this, but really to enhance it with the view that every nurse should see himself or herself as a leader. And why is this so? Because from the very day, even the most junior nurse who makes a decision whether a vital sign is abnormal or not, it is a decision that he or she is leading in terms of he or her practice. So this is where it is important to take the view that as a nurse, even as a novice, I take charge of my practice. I have accountability to be a safe nurse within the influence that I am packed to practice. So once we maintain that kind of mindset, right, imagine what you can do as nurses as you move up the ranks. So when you grow in your clinical skills and your expertise, when you grow in your roles, when you start to lead teams, even as preceptors, as clinical instructors, you have influence over the practice of someone more junior who's learning from you. So once we are able to layer on that, right, and once there is more autonomy because there is confidence in the leadership, imagine how much more we can do as a team. There isn't that need for us to always be cascading for decisions to be made because we are fully capable of thinking. We are fully capable of learning. It's a matter of how much have we provided that conducive environment for that to happen. And it starts first with that shift in mindset that if you can see every nurse as a leader, it is about ascribing the most appropriate level of practice to the role that in that given time point. Then, typically, nurses are seen in supportive roles, right? So whenever there's a new clinical service, for example, there is a new service where they want to triage renal patients much earlier for better outcomes. More often than not, we see nurses play supportive roles, like we would need a nurse and another healthcare provider from another profession as part of the team. My proposal here is that as nurses, given your training, you are fully capable of leading and leading at the appropriate level within the appropriate subpopulation. And I will be sharing some examples later on what we have done in AH, which may be of consideration and may be actually something that may be interesting for some of you. So the move away from playing just supportive and facilitating roles is very key because we are, if you think about it, the ones who spend the most time with the patient most of the time. So it makes a lot of sense that we are placed in a position where we have opportunities to know patients better, and then perhaps inadvertently it's really a matter of reorganizing expectations and roles to facilitate nurses taking on leadership role. So this is something that can be enabled if we are able to view nurses as leaders so that they can lead in roles that can create and innovate so that care can be a lot better for our patients because we have the benefit of being with the patients most of the time. The third point is for all of us, especially, I will use myself as an example. When I was growing as a very junior nurse, the only thing that I was concerned about is I want to be more enabled in terms of my nursing practice. So I practiced in an intensive care environment. So the thrill for me is to learn more and more advanced ICU nursing skills. I think this is very natural because we all start off at the bedside, right? But in the future landscape, what I'm suggesting is, while domain-focused capability building continues to be very important, and some of us may just be so passionate about clinical care, the whole landscape in healthcare, in fact, globally, is changing. The need for us to be more intuitive to use technology, artificial intelligence, in order to enable care would require us to think about new capabilities that we need to build. So some of these things we may not all learn in nursing school because there's only this much time we can spend in nursing school. But it's important that as we graduate into fully practicing nurses, that we be open to perspectives where we potentially can lean on colleagues from different departments with these kind of skill set to be able to learn, because that level of curiosity and knowledge will allow us to think about what this means to nursing practice and how far more it can bring us in terms of advancing nursing. Last but not least, I think for all of us, as we first grow into the profession, it is very natural for us to be teaming within nursing. So we tend to huddle along a lot with, like-minded individuals within the profession. But in this landscape, I think for us to broaden our perspective as nurses, to really be relevant to time, it requires us to think about the importance of teaming cross-functionally, and that is to see the value and the need and the interest to learn about other professions where there are intersections in our care provision. So these things, if you would to take a different dimension to it, right, you may be asking yourself, why is it that sometimes we run into tension with other professions, right? Like, okay, when it comes to helping the patient from the wheelchair to bed to wheelchair, does it always have to be a nurse? Or can it be a therapy assistant? Who answers the call bells in the inpatient area? Does it always have to be the nurse? I think these are grouses that I hear very often from the nurses that I'm responsible for, and that is very telling of the kind of paradigms that we need to shift across different job groups. That patient doesn't belong to a single person in the care team. That patient is our patient. So do we have a shared responsibility to meet the patient's needs? And from that angle, who is the best person to meet the needs? This is where it requires us to take the first step to appreciate what other professions do, and the only way to do that in a very meaningful way is to team with them, is to be curious about them, to build relationships with them, to see how we can actually grow better as a team. So with that as an example of how we can elevate within nursing, I just would like to share some examples of what we've done in AH nursing. So we actually have a very small team of nurses. We currently are less than 500 of us, and we still have a long way to go before our future campus comes up. So in recognizing that it is important for every nurse to be developed as a leader, we took reference from the magnet model. So I've actually put in the reference on this slide, which I believe will be circulated to all of you. So please feel free to find out a little bit more about this source. So we built a narrative to say that we believe that every single Alex nurse at all levels have a voice. And that is because in his or her role, be it an enrolled nurse or a registered nurse, they would know best about the processes that they are involved in on a day-to-day basis. And hence, to give them a platform to be able to appreciate and have their say in how processes are designed is very important. And with this, it also aligns very much with the AH culture, that we have a culture that is learning, that is daring and fun. So this is something that cascade institution-wide, which we hold very dear. So it is not good enough just to say, right? So it's always good to say, oh, let's paste the 10 commandments on the wall, or all the rules of engagement and house rules, right? But in the end, it is how to make all of these alive. And in order to do so, we have built what we call a shared governance model, where we would have different councils for different purposes, where nurses of all levels are actually members. So we have enrolled nurses with decision-making abilities. For example, in the quadrant, the orange one is Person-Centeredness Council. So that is a council that is responsible for the well-being of nurses. So they are the ones who would have a say to say, what kind of opportunities must we give nurses in order to keep them well? So it could be activities that they develop, it could be learning journeys that they create. And this council, I'm highlighting this council because there were a lot of work that came out from this council, especially during the pandemic. Yeah, so we had a lot of restrictions, and our nurses were all very demoralized because all of us were working so hard. Many of them couldn't go home. We had to find ways to lift their spirits, and this is one council that really made a huge impact. And it is only possible because we have nurses of different levels making decisions at that level facilitated by leadership. Another example of how we empower nurses is really through learning. And we have in AH adopted this 70-20-10 development model in which we say that for every single nurse, not only are they given opportunities to attend training programs in different domains, that very importantly, we recognize that within the natural and organic social circle, there will always be learning opportunities because they actually coexist with people from different professions and at different levels of seniority. So hence, this model is very meaningful for us, and this is something which we share with our nurses in terms of creating opportunities for them to experiment and learn. And the experiential learning, which comprises 70% of what learning is all about, requires them to take on different roles and responsibilities in which they are supported so that they can actually apply what they learn in the classroom or through short courses and actually draw meaning from the responsibilities that they are given. So, examples of what else we can do in terms of healthcare system-wide support, that is actually an entire range. And I would say that these are areas that are not easy to deal with, but there must always be a start, okay? So first and foremost, professional equity. What do I mean? I think for the longest time, nurses are just programmed to take a secondary role. I hope this is something that will change with time because clearly we are here for the long haul. And we should, again, if we recognize the value that we bring with us, right, there are places within the healthcare system where we can lead. But it requires hospital leadership, system-wide leadership to be able to recognize the value of nurses. So as we continue to drive this and nurse leaders continue to drive this, I think reciprocally what's important is every single nurse also recognize the importance of having a voice. And we also require leaders to be able to recognize unconscious bias. Like for example, whenever we derive a new clinical service plan, would nurses always be an afterthought? Or are nurses the very first to be engaged, to be conveyed what kind of support is required? And this is something that is very real, very relatable, and hence I'm able to share. What do I mean by enabling a seat at the table? And that is really to have that equity in the voice, in developing new processes, developing new structures in any system that you operate or practice in. Mindset shift in nursing resourcing, okay? So without a doubt, okay, every time I have opportunities to engage nurses, they will tell me, sister, not enough staff, okay? Not enough nurses, okay? We have colleagues leaving, what are we gonna do, right? For as long as we always hope to do things the same way, we cannot expect a different outcome. And that's why it is so important for us to rethink all of the things that we are spending time on. There are potentially a lot of waste in processes. Maybe we think we are already so busy. Where do I find the time to go and review processes? For as long as we don't review, new processes will come in, there'll be more to do. Okay, so these are very important perspectives where, again, nurses need to rethink about how we are spending our time and how we should be optimizing our time. Interprofessional access and collaboration. So this one requires us to really work across different job groups because potentially there may be areas of duplication. So how can we function better as one collective team is really the key here because the whole issue of manpower sustainability doesn't just affect nursing, it affects everyone across industries. Pride and purpose. So this is something which I hold very dear because it is so important for us to recognize the value of our worth as a person, right? So we don't just identify ourselves with the role we assume at work, but we are one unique being. So how do we recognize each and every nurse that we work with and value that in that person so that the work becomes meaningful, because we would spend 2/3 of our waking hours at work most of the time. Last but not least, really, when we talk about enabling care, how do we enable this across boundaries? So there will be boundaries, and these are necessary boundaries for different purposes, but when it comes to building relationships to enable care, how can we look beyond that? Whether you're a nurse from another institution or whether I am a nurse from another institution, we are nurses, and we stand for nursing together. So this is an example of some of the things that we've done in AH. We have something called the nurse-led care for our integrated general hospital patient. So in my next segment of sharing, I'll go deeper into this. But this is where there's a segment of our patients in our hospital that are not cared for by doctors. So there's always a primary consultant, but the consultant doesn't round on this patient every day. And these are patients who are relatively stable clinically, but they still need hospital care for different reasons. So since 2019, we've had this model where nurses lead in the care of this group of patients. So what happens is that nurses are able to take charge of the care of these patients, and they find it very meaningful because they are the ones leading the care, working very closely with the caregivers. That also allows them to really practice at a higher level because they feel that they are empowered and they have autonomy over, the kind of plans that they determine for patients. And in the process of doing so, they actually have to partner very closely across different job groups so that the care plans go according to plan, according to time. And in doing so, they actually also get a lot of fulfillment, guiding nurses who are more junior than them, including the nursing students that join us during their attachments. And this in itself, because of that overarching leveling up, it also allows us to level up different levels of nurses, including letting enrolled nurses assume caseloads. So we have drawn quite a bit of benefits from this, and these are real outcomes which really has been very encouraging for us, which we are currently refining the model. So something which cannot be done without the support from our clinicians, and I think this really has informed us that this is really the right direction to go in terms of the patient profile that we are seeing today in our hospital. So in understanding that nurses create value at every point of care, and this is a model which I believe in one of the earlier segments this morning, one of the presenters shared, really if you look at this model, nurses is really at every single point with every opportunity to do all of these things. But it starts first with us recognizing our value and rethinking what our roles are in terms of value-based care so that we can really do our part to advance this further. Okay. So again, what do we hope to see eventually is all of these benefits to patients, to providers, payers, suppliers, and society. Okay, so with this, I actually complete this segment.